So this patient, Tanis, for her Tixel treatment, we're going to do two treatments here. We're going to do a treatment on her eyelids using the Tixel eye piece, which is a very much smaller head to specifically work on the eyelid skin. And we're looking for this eyelid skin to tighten as much as possible, to certainly can help lower eye bags or laxity of the lower lids, and it can help this excess laxity in the upper lids as well. So we're going to do an eyelid treatment first, and then we're going to do a Tixel Mezo-Therapy treatment to help with pigmentation. So we're going to do a lower setting to basically just get the skin to become more porous and to allow the little channels to open up so I can put products on the skin which I know will start to suppress these melanin producing cells, these melanocytes that are causing this irregular pigmentation. This is quite a common problem in patients who have slightly darker skins, Asian patients, or even patients from the Mediterranean countries such as Tanis here, that have a higher probability that they can get pigmentation disorders in their skin. So we can use the open channel effects of Mezotix to our benefit to try to reduce that hyperpigmentation. Okay, so I'm going to start with the eye treatment. It's a much smaller head that we got here to allow me to work very closely on the eyelid itself. So we'll start with a little bit of treatment just on the surface of the skin over the eyelids. And as we know, the eyelid can be a much more sensitive area, but we've had anaesthetic cream on for a little over half an hour, which is giving good anaesthesia here. How are you feeling? How's it?
It's absolutely fine.
So there you go, we're in a very sensitive area. We're using a little bit more of an ablative setting on the eyelids to try to get the eyelid skin to change. Even though this plate is heating to 400 degrees C, it's very safe, even this close to the eye, to be using this treatment. It shields the eye itself, so the plate can never touch the eyeball.
It's very comfortable. I don't know what I was expecting, but it's not sore at all.
Okay, so that's the eyes done. That's what's called a periorbital ablative treatment. You can already see the eyes have gone quite red, a little bit puffy. That's what we'd expect. That redness, puffiness is going to be there for a day or two. The skin will be dry, and I'll encourage Tanis to use a very special moisturiser that we'll supply as part of the treatment to really intensively moisturise the eyelid skin and allow it to heal very quickly. And after 2 or 3, perhaps even 4 treatments, we should see quite significant tightening of this eyelid skin. So I'm just demarcating my treatment areas just to make it a little bit easier for me, just to make sure I don't miss areas out really. Finish the treatment now. The ablative settings around the eyelids and the Mezotix on the face and the neck. So I've just put on a mask. This is a hyaluronic acid mask again, a rejuvenation mask, and we've spread that over. I've also used a a lightening serum. So by light we mean something that reduces pigmentation. It's got active ingredients in it to suppress the melanin cells. So we'll hopefully see an improvement down the line of the pigmentation that this patient has on the cheeks. So that's his second treatment. How did that go?
It was absolutely fantastic. Far less painful than I was expecting. It just literally feels like tiny little pricks.
Yeah. And how do you feeling with the mask on now?
Oh, it's as cool as cucumber. It's
Okay.
lovely and very relaxing.
Great. Well, we're going to leave you for 20 minutes. Let everything soak into the skin. Don't forget the micropores or microchannels of the skin. The porosity of the skin is now at its peak, and all of that goodness is going to be soaking into the skin. So we'll leave you for 20 minutes.
Mm-hmm.